I'm with George Wong, and George is a worker at Kaiser Hospital and has been active in the National Union of Healthcare Workers. Welcome.
I'm a inpatient pharmacy technician at Kaiser San Francisco Medical Center. I'm a founding member of NUHW and a supporter. And I've been just very active in NUHW and hopefully that we can win an election to change unions at Kaiser. Currently, our union, SEIU UHW, has become a union that is not responsive to its members anymore. Members have lost their voice in their own union. SEIU has become more of a corporate, boss-friendly type of union, and we see the result of this by the contracts that they've been negotiating and the takeaways that are being accepted by our union by the employer. We just feel that we can do better at NUHW because we used to be the former leadership at United Healthcare Workers West, and when we were there, members had a voice. Benefits were not being taken away. And the future for unionism really comes down to this battle here between NUHW and SEIU. How is history going to record this? What is unionism going to look like in the next 50 years? And it better look like the union that we used to have, which is member-run and member-driven. Because if we're going to settle for what SEIU has become, a corporatized union, then union members don't have a chance.
Well, there was a struggle. You had an election, NUHW lost, and there was a lawsuit in which the court ruled that there had been collusion with the union and Kaiser. Were you surprised by what happened in the election and how apparently the SEIU, according to the court, was working with Kaiser management against the NUHW?
Well, no, I wasn't surprised at all. I was actively organizing for NUHW, as is our right under federal law, labor law, and we could see it. I mean, Kaiser showed a lot of favoritism toward SEIU and gave them a lot of access, and at the same time was restricting us. And having said that, Kaiser was still telling everyone that they were remaining neutral. That was far from the truth. I think the results from Judge Parker's overturning the election, demonstrated that. So yes, I saw it firsthand. Kaiser, was in collusion with the SEIU and vice versa.
And what effect did that have on the workforce, where the management was working with the union, SEIU, to basically coerce people to vote against the NUHW? Well,
they were constantly being watched. And the actions that Kaiser took on withholding the 2% raise to our NUHW employees or union members that voted to join NUHW last year, ironically, and it wasn't by coincidence, coincided with SEIU's campaign of terror by telling union members that if they voted for NUHW, they would lose their contract, their benefits, their raises, their health plans. So there's no coincidence. Okay, so employees were generally scared. They were coerced into not voting for another union. The atmosphere was such that no one could have done what we wanted them to do, which was to change unions. It was just impossible.
Now, what are the specific examples of how Kaiser has taken advantage of this situation to advance their economic agenda as far as the union and the workers?
Well, they're going piece by piece and dismantling the contract that we had, which was the golden rod contract of the nation as it comes to healthcare professions. They're rolling back our healthcare. They want us to pay for more.
How much do you pay now?
We don't pay anything. We don't pay anything. They're looking.
Should you pay anything?
No. Kaiser is as an HMO and also provides the insurance. And we're healthcare workers. They should be providing it for us. That's the way we see it. And Kaiser has been very profitable, $6 billion over the last 2 years, I think. And the employees of Kaiser have helped Kaiser be very profitable. So they should be giving more to the employees than taking it away from them.
Well, where is this $6 billion that Kaiser made in profits going? They say that they're a nonprofit.
They're nonprofit, but we understand that Kaiser is expanding to the east. to the East Coast. They're opening up more hospitals out there. And so their ambition is to probably get into position to when, universal health care comes in, that they'll be in position around the country to take advantage of it. And I'm not saying that that's bad, but I'm saying that you shouldn't do that on the backs of the healthcare workers in California, which were enjoying some of the highest benefits in the nation.
Now, recently, the CNA, which has had a no rating agreement with the SEIU, are going to support you, join with the NUHW on September 22nd for a strike that you're going to be having. Why is the CNA decided to work with you on this strike action? Yes,
September 22nd, California Nurse Association is going to join NUHW in a sympathy strike. Presently, right now, NUHW, we do represent 4,000 Kaiser members because we did win certain elections last year. We are in bargaining, and Kaiser has put a lot of takeaways on the table. NUHW said instead of the takeaways accepted them, we'd rather go on strike. California Nurse Association knows that this is Kaiser's long-term plan for 2012 for the coalition of unions at Kaiser. The takeaways are here. We know that they're going to be on the table. We pretty much know that SEIU is going to accept them. And the problem with that is that all the other smaller unions in the coalition are going to have to accept it because Kaiser has the bigger vote. SEIU has the bigger vote. And then Kaiser's going to turn that around and force California Nurse Association to take the same cuts. So I guess they saw that supporting SEIU is just probably not in their best interest. So they're going to stand with us in solidarity and a sympathy strike to say no to the takeaways, because it's coming down the road for everyone.
Now, the issue of single payer, of universal health care, of getting rid of the insurance companies in health care, what's your view on that?
Well, I think even if you look in Europe, insurance companies really, don't go away, but they participate in those programs, okay? And I think the big scare tactic has always been that, oh gosh, look at all the insurance companies and are going to go out of business and all those people are going to go out of work. Well, that's just not necessarily true, right? But I think a universal health care is necessary in this country because not only do I believe it will bring back industry into this country, but I believe it's a fundamental right that everyone should have basic health care coverage.
Well, do you think that money should go any other place than to healthcare providers who are actually providing healthcare? I mean, if you pay for healthcare, shouldn't it go to healthcare providers?
Well, it should, yeah. I mean that's the way it should be. But who knows where the money is going now? It certainly isn't trickling down to the workers and to the folks who need healthcare. So what is the problem? I mean, I think the blame has always been that it's the middle guy, right? And says, well, I think we've lost sight of who the middle guy is, and we need to look a little closer is the people that we work for.
Now, why don't you talk about how Kaiser is trying to outsource its operations and the effect that it's having on the workers at Kaiser?
Well, yes. I mean, we've long already known, especially in our Southern Cal facilities, that some work is being outsourced, mainly in the areas of environmental, housekeeping and material services. I mean, there's some jobs that have been taken away from material services. Some providers come in and they bring in office supplies, and it used to be that our folks used to take those from the dock and bring them in and deliver them to the office, and now they've lost that. So it's little by little pieces are being taken away, and before you know it, outsourcing is going to happen. And let's face it, it's a lot cheaper for Kaiser to outsource than to pay health care for its employees.
And how does this affect the patient care at Kaiser?
Well, we've long been struggling with getting more staffing because patient care is important to us at Kaiser. I think the Nurse Association was also asking for more staffing for patient care. I think I saw the letter that Kaiser put out to the Nursing Association about the strike and said that you're putting patients' lives in jeopardy. And then, CNA responded and said, well, we've been asking you for a year now for additional staffing for patient safety, and you've refused. So, that's where I think Kaiser's at with that. It's a ruse. I mean, we want patient safety because that's what we provide. We can't do it if we're understaffed and we're overworked. Just can't, and if we're worried about our health care, we just can't provide that.
Now, the number of and percentage of workers and unions in the United States has been nosediving. There's now an attack on public employees to try to break public employees' unions. The state of labor is in dire shape. Why isn't there more fight back within the labor movement of the workers that are there and to kind of give a direction or strategy?
Well, you know, I think I would answer that as why isn't there more fight back from the union leadership that we elected, okay? I know that when we try to speak up and say, look, this is wrong, most of the unions that have gone to more corporatized style prevent you from speaking out. That's the problem. Union members are losing their voice. They're losing their rights within their own union. And it's because of the leadership that's in place and the direction that unions are going. I think unions need to realize is that members are the ones that run unions. And they need to have an input into what is going on. So their voice is important. But when you coerce members and tell them that you cannot speak against your union or else face consequences, then the voice is lost. And that's how come workers aren't speaking up anymore. Also, we have a real lack of real union leaders out there that are willing not to accept the status quo, but to stand out on their own, like the previous great union leaders that we used to have in this country, to stand up and say no, no to big money, no to big politics, and take a stand for the workers.
Is there a lack of education? I know on Labor Day they have the labor programming, some labor programs, some films on KQED or PBS, but in general there doesn't seem to be any labor education, any labor media to really educate people about the history of unions.
No, there isn't. That's how come I'm glad that you're here, because you provide a lot of that education out there. But I really think that unions should provide education to their membership. I know when I was with the NUHW and in their leadership, we did just that. We used to take busloads of folks down to the state capitol and show them how a bill is passed and things of that nature. Showed them how labor got started, unionism got started. They need to be educated in that, because the youngsters that are coming into the labor market today don't know the past and don't know the sacrifices that previous labor leaders did for them to have what they have today. They just don't know. So an education is necessary, but unions need to take the lead on that.
Are you optimistic about the future?
I'm optimistic about this election. I think NUHW is going to prevail. Am I optimistic about labor, unionism in this country? I think I am too. So sooner or later someone's going to wake up and find out that without the labor unions, this country wouldn't have moved after World War II. We wouldn't be where we're at right now without the labor unions. Okay, that's history. And I think the big debacle of Wall Street is an indicator of that. There's not enough blue-collar workers. There's not enough industry. There's not enough work in this country right now because it's been shipped out. You need unions. You need good workers. Not everybody wants an MBA or a BA. Somebody just wants to weld or work on cars. And we need to bring that education back.